Hello, everyone. Bonjour à tous. I'd like to welcome you all to our webinar today on charting a bold future for Canada's health workforce. My name is Marcel Saulnier. I'm an associate with Santis Health and have spent most of my career in health policy in the federal government, including as Associate ADM of Strategic Policy at Health Canada. And I'm speaking to you today from Ottawa, part of the traditional and unceded territory of the Algonquin people. I'm joined by Victoria Wiebe, Santis Health's Director of Strategy and Policy, who will be co-moderating the discussion with me, and Victoria will introduce herself in a few short moments. The focus of the discussion today is to explore what it will take to advance change for Canada's health workforce and the role of collaboration in driving the change we want to see. And we're really, really fortunate today to have with us 4 distinguished panelists who will share their perspectives and experience on this critical issue. But before moving forward with the discussion, just a quick word on who we are at Santis Health. We're a consultancy with offices in Toronto, Ottawa, and Vancouver. We're dedicated to providing first-class counsel and support to clients that work exclusively in the health care and life sciences sectors. And as you can see on the slide, the key areas of focus for our company are in public affairs, strategic advice, policy, and communications. Now to the topic of the day. Over the last few years, and particularly since the pandemic, we've all witnessed a growing crisis of health human resources across our health systems. It has manifested itself in different ways, and you see in front of you some of the alarming statistics around burnout, mental health challenges, and workforce turnover. We also know through polling that Canadians are seized with this issue and are overwhelmingly supportive of governments developing a sustainable long-term plan for the health workforce. But the path forward won't be easy. And on the next slide, you see some of the really, really challenging issues that governments and stakeholders will have to navigate over the coming years. Issues around training and education, recruitment and retention, workforce well-being, models of care, data and planning. Those are all really challenging issues in and of themselves, but taken together present, I think, even greater challenges for collaboration. And you may have seen in the recent health funding agreement between the federal and provincial governments that there is a priority being placed on the health workforce crisis. And a recent statement issued by health ministers also points to some actions that are being taken to support Canada's workforce. But is that enough? What more needs to be done? And to help us answer these questions, we're joined by 4 panelists today. I'll just quickly mention their names and affiliation, and then we'll ask each of them to introduce themselves. We have Dr. Kathleen Ross, who is president of the Canadian Medical Association, Dr. Sylvain Brousseau, president of the Canadian Nurses Association, Dr. Wiebe Bourgeault, professor with the University of Ottawa, and Kirsten Kirsten, I'm drawing a blank here because your last name is hidden. Kirsten, my apologies. President of the Canadian Association of Physician Assistants. So let's move on to Kathleen for a quick introduction.
Thank you very much. I'm a family physician working in Coquitlam in Westminster, just outside of Vancouver here in British Columbia, who's held multiple leadership roles from my grassroots division of family practice to provincial and now federal roles, trying to address some of the challenges that we see in healthcare.
Okay, thank you. Dr. Brousseau.
Yes, I'm an associate professor at the University of Quebec en Outaouais. I'm a nurse since 1993, then 30 years. I've been working in different clinical and management sectors in Quebec. And I've been as well on different nursing board of director since 2002. And now I'm the president of the Canadian Nurses Association. And my research work. It's about the quality of work life among nurses and as well nurse managers. Thank you.
Merci. Dr. Bourgeault.
Hi, so yes, in addition to being a professor in the School of Sociological and Anthropological Studies at the University of Ottawa, I hold a University of Ottawa chair in gender diversity and the professions. I lead the Canadian Health Workforce Network, and I co-lead the Team Primary Care Training for Transformation initiative. Thank you.
Thank you. And Kirsten Luomala. Again, sorry for the senior moment there.
That's okay. I've been involved in medicine for over 35 years. I'm a former military medic / PA. I've traveled around the world. I've seen countries like Haiti, Afghanistan. I was part of the PA instructor cadre at the Canadian Forces Medical School, and I also helped develop the Afghan National Army's Combat PA program. I've been in Alberta now for 10 years. And I've helped develop our regulatory process here for PAs as well as our compensation package.
Great. Thank you all for taking the time to be with us today. I will now hand it over to Victoria for a quick intro on her part and to go over some housekeeping issues before we launch into the discussion.
Thanks so much, Marcel. And hi, everyone. Great to be here this afternoon. My name is Victoria Wiebe. I'm a director in Santis Health Strategy and Policy Practice. I help organizations solve complex problems and navigate change in the healthcare system. And one issue in particular I've spent a lot of time thinking about is our health workforce crisis. So delighted to be part of this panel today. Before we move into today's discussion, I just have a couple housekeeping items to share. First, you will see that on your Zoom browser, there's a function to submit questions to our panelists. Please feel free to submit any questions you might have at any point during this presentation. We have pre-prepared 3 questions for our panelists to get the discussion going. We will go through the first 2 questions before we turn over to the audience Q&A. We'll select 1 to 2 questions for the panelists to respond to, and then we'll close with our 3rd question. At the end of the webinar, we'll share a link to a brief survey to gather your feedback on today's discussion. And we'll also share both the slide deck and a recording of today's webinar via email following today's discussion. And with that, I suggest that we jump right in. So we'll start first with a question to all of our panelists. The health workforce challenge has been commonly referred to as a crisis, and yet much of the response to date has been incremental. Think long-term action plans, reports being commissioned, and groups being convened. And I'd love to get each of your perspectives on why you think this is the case.
So I'm happy to jump in. I mean, certainly these are not new challenges for us. We've recognized that there's a growing challenge in our human health resource since the 1990s. It started with hospital bed closures and a lack of increasing community-based resources. Now, as a family physician, I have felt that throughout my career. We saw this coming, but what was really missing was an understanding of what our human health resources were across the country, who's doing what, where, when, delivering what kind of services. So that lack of long-term planning, while it may seem incremental in one way, it's actually where we need to start. We need to have some idea where we are now and how we're going to move forward. And I think that most Canadians understand that moving forward, we need to have a health workforce that meets their needs. And to get a truly integrated human health resource plan, we need to collaborate with everyone, those who provide care, those who seek care, and those who actually organize care in Canada. And that's going to take a little bit of planning, and it's going to go slowly until it doesn't.
Thanks. I would add that it's important to highlight that this is a truly structural crisis, and we saw reforms over the last three decades, and we have been through health workforce challenges before, but this is unprecedented. And with supply shrinking, demand and aging population increasing, we face a perfect storm right now. And we also find out that there is a lot of uncertainty for decision makers, notably economically and technologically. And we also know that policymakers are always looking at similar jurisdictions for potential long-term solutions. But the reality is that the entire Western world is facing health workforce shortage right now. It's not just in Canada, but it's across the world. We also believe that we are at a crossroad, and with primary care declining everywhere in the country, it's a huge issue. And CNA anticipate major health reform from coast to coast to coast, and nurses want to share their perspective on the mid and long-term bold solution to fix these concerning trends once and for all. And we also bring tangible and innovative solutions, and thanks to our critical mass, but also our various nursing experiences throughout the healthcare system over the decades. And as the largest health workforce, nurses' true potential remains restricted by the statu quo. But this will need to change, because old school reform can no longer deliver significant outcomes for the populations. And I will also add that the health system will need to become more flexible, to become more efficient as the right health professional for the right patient at the right time, at the right cost principle. And we also must think about re-imaging our model of care that need to be modernized. And to end, I would like to say that health professionals have been working closely together these past months to support a team-based care approach, and improving access to primary care involve interdisciplinary team where each health professional is working to its full potentials. And this is not the case right now. And this would be a game changer that significantly improve Canadians' health outcomes and our health system overall efficiencies.
Yeah, I will just add, thank you so much. I would concur. This is a structural crisis. This is a crisis that's different than the crises that we've experienced before. You know, health workforce challenges are longstanding. I mean, the health system is the way that patients access the health workforce. So when we talk about health system challenges, those are health workforce challenges. So those have been, embedded into our system, but this is unique. It is experienced everywhere. And it's a complex problem. It's multi-layered. It's what we call sort of a wicked problem, has multifaceted elements. And so we're beyond low-hanging fruit. We need a multiple intervention strategy, and we need to do something today because we're in a crisis where we need responsive, reactive responses to this crisis to react to like what is happening now. But we have to embed into this system what Dr. Ross had said, a culture of planning, so that we are looking upstream at preventing these crises. Let's get started with that now, right? We don't have to wait until the data are better. Let's work with the data that we have. Let's start planning, and let's start implementing evidence-informed solutions that we have to the crisis at hand. And many of those solutions are very much, we need an all hands on deck approach. I'm always struck, I'm not a healthcare professional, but I'm struck at the intelligence and dedication of all health professionals, and how some people are called to do midwifery, some in family medicine, some in nursing, physician assistants, pharmacists. You're called to those professions for different reasons, and you have invested time and energy in developing competencies, and we should be working together. We should be training together. We should be working together with all hands on deck for this crisis now, but also into the future.
Absolutely. I echo what the other three have already said. And I think one of the things that we often have to remember is when we talk about a crisis across the planet, Canada is a very unique country. Our geographical and our population bases are very unique. Majority of our population lives within 3 hours of the border. We have to look at solutions that not only meet that population, but those population groups, but we also have to look at solutions that meet to our north, that meet to the prairies, to the coasts. And if we don't have this big, broad spectrum look at these solutions and start planning yesterday, we're not going to have a solution, and we're not going to have an effective healthcare down the road. And so having these conversations makes sense. And I love the comment about, we start making plans now. We change those plans as we gather more data, and we react as the ball is rolling. But we have to get that ball rolling now to make things change.
Thank you all for your contributions. I think great way to get us started. Clearly, from what we've taken from your remarks, this is not a short-term solve. This is about changing culture and moving towards planning, towards collaboration, and doing things differently. And Dr. Brousseau, I think, especially as you have noted, starting to think differently about how we deliver care, which I think is a nice segue to our next question, which Marcel will introduce for us.
Yeah, thank you, Victoria. Thank you for those responses. And Dr. Brousseau, you mentioned team-based care as a game changer. And I'm wondering, you know, if each of you could give us your views on how team-based care can advance change in the health sector, in the healthcare system, and how will this actually come together? And in that context, some of you represent associations and provider organizations. You know, how can you and governments and other stakeholders come together differently to in charting a path forward on team-based care? So, Dr. Ross, go ahead.
Thank you so much. So as a family physician working both in community and acute care, I have been part of various teams throughout my career. I think it's critically important now to recognize that we have to actually have a cohort of people working together as part of a primary care home, an entry point. Many of the challenges that we face currently in our health workforce crisis are reflected in the lack of access in our healthcare system. We know that there are definitely skilled providers that can add to that home base and help to provide primary care in a way that makes sense to physicians. Just this last month, the Canadian Medical Association brought together more than 40 healthcare organizations from across the country, and we had wholesome discussions around what services would need to be provided in the future. How would they be delivered? Where would they be delivered best? And definitely stayed away from the who would be delivering those services, as an understanding that we have to work collaboratively in teams and leverage the skill set of all potential healthcare providers. And a big part of that work was looking to address the administrative burden, the workload that is faced by community providers that is driving burnout. Some of that is sheer volume, some of it is lack of access to other resources that we need, driving that moral injury when we can't provide the level of care that we want. And part of that is, you know, a lack of a healthy work environment, a balance for providers across the system. So really looking to leverage team members. And I will also add that depending on the practice and the patient population served, those teams are not going to look the same. So it needs to be flexible enough to reflect the population that we are trying to serve at that given time. And we need to be able to collect data on what services are being met where, so that we don't have gaps, as you know, as Kirsten pointed out, in those rural, remote areas that are away from the larger healthcare centers, and work to support them. And of course, part of that is a mobile physician and allied health workforce that can be deployed where it's needed, when it's needed. And a huge part of this is going to be leveraging virtual care. So I'll leave it at that for the moment. Thank you.
Okay, thank you, Sylvain.
Yes, thank you. I echo what Dr. Russ just pointed out, and I will also add that in every region we see an increasing number of health service interruptions, and patients are waiting longer and longer. And with the short age of nurses as well and other professionals, that's having an impact on the access of care of the population. And healthcare workers are overworked, as mentioned by Dr. Russ, and many choose to leave the profession. And we saw that in recently a report in Quebec says the nurses less than 35 years old, 44% are leaving the profession. And despite this, health remains a top issue for Canadians. And we are glad that all governments from all political stripes are getting together and work together to understand, and we must all unite healthcare workers messaging on the health human resource crisis. We must all work together, and CNA was there with 2 weeks ago with the Canadian Medical Association and 38 others organization to work on a solution and to bring solution on the table. Health reforms are already on the way to improve access to primary care for all Canadians. We see that in different jurisdictions. And yet, as I said earlier, the status quo is profoundly embedded in our healthcare system. We need to think out of the box and bring new solutions. And the rules of this system can no longer allow inappropriate outcomes right now. And team-based care is the way forward. And for nurses, this does not necessarily mean physician-led team. Every health worker has a role to play in improving Canadians' health outcomes to make sure that every population get access to the healthcare system. And we can replicate effective nurse-led initiative as an example from other jurisdictions in Canada as an adjunct to the team-based model currently in use in Canada. And health workers should work to the full extent of their scope of practice under the right, as I said earlier, health professional, a right patient at the right cost principle. And we believe it is time for bold reform by deploying nurses and nurse practitioners' true potential by letting them work to the full scope of practice and expanding it. Because what we see and studies have shown that nurses are working at 52% of the scope of practice. There is 48% of non-nursing activities they are doing, and we need to make sure that they are working at 100% of the full scope. And that also means optimizing the scope of nursing practice and consolidating it, because sometimes when you are doing non-nursing activity, it means that you don't consolidate what we have. And do not forget that team-based care with empowered nurses is a key in improving access to care for all Canadians in all areas of the health systems. And for instance, nurse practitioners, as everyone knows, as a primary care provider, play a major role, and they can diagnose, prescribe, refer, and connect patients with other health professionals and specialist doctors as well, among other things that they can do. Thanks.
Okay, merci. Over to Ivy, your
Yes.
perspective on this issue.
Thank you. I'd really like to add to that. And growing up in a rural area, very much experienced gaps in services. From a system perspective, gaps in services, but duplication of services are two important challenges. And when we have duplications of services, it means that we're not coordinating care. And so team-based care and really effective team-based care is an important solution to that duplication. So we're utilizing all of the resources and the skills that different healthcare professionals can bring to the table, and doing so in a way that's collaborative, right? Not substitutive, but collaborative. And that collaboration is something that needs to be learned, right? That's, what my colleague Ivy Anderson refers to as the secret sauce of team-based care. And so I just want to mention a little bit about what we are doing at Team Primary Care. And why we focused on primary care is because, we have two crises. We have a health workforce crisis. We have a primary care access crisis. And so to focus on primary care is to focus upstream, because what we see downstream in emergency rooms and hospital wait times is because people don't have access to primary care. So let's focus upstream on sort of fixing that. And how do you best collaborate together and work together? Some of that is very much structural, absolutely, but we're trying to focus on training because that hasn't been enough of the focus. You could use the analogy of we wouldn't send a hockey team out there, without practicing together, or jazz band without practicing together, but we seem to do that. And what we're trying to say is we need to learn about what all the different practitioners can do, learn from and learn with, right? And that gives you that structure to enable to have that flexibility that Dr. Ross mentioned to meet the needs of the public in a way that, jazz improvisers are able to do that. There's a structure behind that because they know what part everybody plays. and they can be flexible to meet the needs of a community. And so we really need to develop the most and use training as a pathway, and then provide other inputs into that in terms of funding the different providers in ways that are collaborative. We need to regulate in a way that recognizes team-based care, because we're really in a system that is very siloed for so many different ways. Training is siloed, regulation is siloed, funding is siloed, and we have to break those down. So my hope is that we can move those actions in a collaborative, concerted way to recognize that the complexity of population health needs requires a team to do that. Not everything, but increasing complexity requires team-based care. Those are some points that I would make.
Okay, thank you so much, Ivy. Great points all around. Kirsten, the profession you represent is a relatively recent arrival on the sort of the mainstream Canadian health system scene, not so much on the military side. How do you approach this issue of team-based care from a physician assistant's point of view?
Well, I mean, PAs are the ultimate team-based collaboration, right? We don't exist without our physician supervisors, and so we see directly the impact that we have. There's been studies out of Winnipeg that show having a PA on an orthopedic service, for example, can actually decrease the wait list to get to surgery significantly, because it frees up the physician to be able to go in and do the surgery while the PA is doing all the managing of the care. You know, the stumbling block for PA integration in Canada has certainly been the political climate. You know, although this past year we've seen some incredible growth. We're now in every single province. We've doubled our education programs. But that's just a start. That's just a drop in the bucket. And it's not just PAs that need good integration into the healthcare system. We need more nurse practitioners. We need more family doctors. We need more healthcare aides. We need everybody from the bottom all the way up to the top. And they all need to work together to be able to identify that. Funding is going to be a huge issue. We need to have not only the federal governments, but the provincial governments saying, yes, here's some funding to get these initiatives off the ground. But we also need, and I know there's a lot of work going on this, is bringing in international workers. You know, right now we need to increase our numbers while we're starting to train our personnel to fill these gaps. And the easiest way to do that is to look outside of the country and bring a faster method of bringing in international trainees. We just recently, in the PA world in Alberta, it's taking us over 6 months to get somebody in from the US who's an experienced PA provider. And those are the stumbling blocks that we need to really identify to be able to move this forward in a collaborative way.
Okay, thank you all for those really thoughtful responses. I'm now going to just go to some of the questions that we've seen in the chat, and maybe open up with one that I think was referred to in several of the questions. Notably, I mean, we have 3 professions represented on the webinar today. Of course, there's a much broader array of professions that work across the health system. And so how do you bring those other voices into the conversation on reforming and addressing the challenges around the health workforce, the team-based model issues, other structural changes that need to happen? Who are those voices, and how do you bring them into the discussion to fashion a collaborative approach to moving forward? Dr. Ross, first.
Thank you. I should probably let somebody else speak first to this issue, but I think that there's no question at all that the future of our healthcare system is going to involve collaboration, and collaboration across all health providers. The key to this is going to be having those conversations about where are the gaps, and who actually has the skill set that we can either leverage or amplify and improve on their skill set, as Sylvain has said. while linking together, sufficient level of expertise inside of those teams to ensure that the patient's needs, if they're not met with one level of provider, that there are subsequent experts within that team network that can actually address the needs to the best of our ability, and that's going to take collaboration. I want to touch a little bit on what we need for patients versus who has got the skill set, because we know that there's a huge variety in the skill sets across our nurses, our nurse practitioners, our PAs, our family doctors, even our specialists. We have to actually identify who can provide what service, but not just based on title, but actually based on the skill set that they carry, and then have a look at where in our teams we need to amplify those services, and it's going to take collaboration. And training together is an excellent idea, and I'm going to pick up again on the it's not a substitution process that Dr. Bourgeault has said, because I think that it's really important that we understand that we have to be respectful of each other's skill sets and really put the patient and the patient needs at the focus of what we do, and then wrap around the patients those providers that can provide that skill set. That the example I often use is that, yes, I can see musculoskeletal injuries as a primary care provider, but it's equally appropriate for someone to speak with a physiotherapist on the team first, looking at amping up physiotherapy skill sets, so what we would call an advanced practice physiotherapist across Canada. These are professionals that aren't being leveraged to their maximum scope as yet. And when we have a hard look at what services that Canadians are going to need from their healthcare system moving forward, then we can take it back upstream and say who needs to be part of your care team.
Okay, thank you very much, Kathleen. Who else wants to weigh in on this question? Ivy?
Yeah, I also want to add, and I think it picks up on another one of the questions. I think we need to recognize that managers, leaders are also part of the team. I think we have zero data on them. There's no planning on them. They have also been burnt out during the pandemic, and we haven't sort of taken that as a focus. And I think the more that we collaborate, are inclusive of all the different skill sets that are brought to it, these skill sets could be administrative support skill sets, which we have not been utilizing very well. These could be skill sets around actually providing clinical care, supervisory skill sets, education skill sets, right? When we say things like we're going to ramp up training programs, like spots in training programs, are you increasing the complement of faculty to do those things, right? So just being mindful about what are all of the implications, right? It's like squeezing, like a complex problem is like squeezing a balloon. It causes things to puff out on the other side. So you need to kind of recognize that and to be much more consultative, collaborative of the different stakeholders that have a stake in this game, in the sense that they have something that they can do, and you want them to know. You don't want them to be surprised about something, right? You want to be coordinated and building collective solutions going forward. So those would be some additional elements I'd add.
Great, thanks, Ivy. Sylvain?
Yes, I would also, and by the way, echo what my two colleagues just said, and I always bring that that's all start with education and training. I'm going to take an example of my university. We do have a collaborative courses and even simulation, make sure that each student in different physician, nurses, or other healthcare professional knows what each of different professional where they can act and know what is the role of each professional. And when you have a sense of what each of different healthcare professional are doing, then you prepare them and make sure that they develop, competencies to work collaboratively with other professionals. I would even say that we could have other professionals like paramedic as well, to make sure that, we have a sense of who is doing what, and because we have there is so ambiguity even through our nursing role. And when we know what a LPN, a nurse practitioner, or nurses are doing, then you and other professionals, then you are able to provide, efficient primary care to the population. And you need to make sure that you understand what each professional are doing, and make sure that we don't replicate silos, and make sure that all of us are working all together to bring the best care to the patient, and make sure that it's the patient is at the center of the care of the healthcare system.
Absolutely. Busting those silos is key. Over to Kirsten. Anything to add?
I think everything's been said that could be said on this particular topic. I agree with what everybody said. So,
okay, thank you all for that. Over to Victoria to broach another question then.
Thanks, Marcel, and thanks everyone for your questions so far. There's lots of great questions in the chat, and it's hard to pick just one or two to respond to. Our panelists have been responding to questions we may not be able to get to via the text response function. I'll pull one more into our verbal discussion. Dr. Ross, you had mentioned earlier in today's discussion that we can't plan for what we don't know. And so with that in mind, I wanted to bring forward the following question from the chat. What data do you wish we had about the state of health human resources in Canada?
So actually, that's an excellent question, because any improvement on the data that we have would be substantial. So we have to push past it just being a numbers game, where we say we have this many of this type of specialists, this many nurses, we have this many personal support workers in the community, we have this many of PAs. We actually have to have an understanding of what services they're providing, over what period of time, how often, where, and through what type of provider, whether that's in the community as an independent practice or working as part of a collaborative team, or in an acute care center, because it actually changes the number of services that they can provide. We also have to like a little bit of a longer term lens for this. With the average age of family doctors being over 50, as an example, we need to be prepared for that retirement wave that's hitting us, and scaling up training for family physicians has been critically important. Looking at what Sylvain and I like to call the leaky bucket. So we train more people, we put them in the top, but the workplace is so toxic and really morally distressing that people wind up burned out and leak out the bottom. So it doesn't matter how many more people you land at the top if we're going to keep losing them out the bottom. So tracking, who's leaving to go and do what. You cannot, in my profession as a family physician, you can't count a family physician as a family physician as a family physician, because the skill set is so expert and broad that many have deployed their services into palliative care, into mental health and addictions, into obstetrics, and various other aspects, including emergency room services, which of course we need. And many forget that the majority of emergency room medicine delivered across Canada is actually family physicians providing that care. We're providing care in those settings. We're not providing the longitudinal care in the office practice that Canadians traditionally see as accessible. So all of those are major data points. And to pick up on what was said a bit earlier, it doesn't need to be perfect to get started. We need to get a minimal viable product off the shelf that we can begin to iteratively build towards, and understand where those gaps are, so that we can ramp up our training. We can ramp up our ability to bring in those internationally trained healthcare providers across the spectrum, many of whom are already in Canada, and look at ways that we can support them through practice-ready assessments, through collaborative team-based care, where we can ensure that they've got the appropriate skill set to feel supported delivering care in our healthcare system. This is all data that we need to collect.
Well, I have to answer a question about data, being a pointy-headed scientist, of course. So, we just had a conversation about team-based care and how we need to move towards that. So that necessitates that you have comparable data across the different practitioners. And the data need to be standardized, right? You wouldn't build a house if you could only use 3x3s in Quebec and 4x4s in Ontario and something completely different in Alberta, right? We have standard measures, we have standard tools. And, you know, Canada's health workforce represents 8% of our GDP. You'd think that we would have more standardized tools for that. So I would strongly encourage that so that we have data that are comparable. But the best way to develop data is to use data. And in that feedback from utilizing your data, you say, oh, if we just asked it this way, we could answer these other questions. So it has to be this dance, an iterative process between developing data and utilizing data. What are the best data? Data that are accessible. We need to have access to those data, timely data, so that we're not looking at data like a long time ago. So data that's used, data that's usable, right, for a variety of different things, and accessible is really important. And I'm really excited about the opportunity that there is with the federal government investing in a Center for Excellence on the future of the health workforce, which will be a substantial foundation about that, is improving the data. But let's get started. We can gain some insights about what data that we need by utilizing it and improving it. And it really is about improving the data for those workers that are somewhat invisible to data right now. Someone had mentioned in the chat about personal support workers, or the various 20 different names that they're known from about across the country. We know very little about them, and that really was challenging during the pandemic. But there are a whole host of mental health and substance use health workforce providers that we don't count, we don't know anything about them. And just my final point is really, really to emphasize the point that Dr. Ross made about we have to get beyond headcount. We have to start measuring how people are working and getting at capacity, right? Because yes, I mean, people could say things like, there are more registered nurses in Quebec than ever before. There are more family physicians in Canada than ever before, but that belies the point that they are doing different things. And so we need to look at their activity rates, their participation rates, and the productivity and how they're working together and what models. So let's get started on that, but ensuring that we are shoring up those providers that we know nothing about right now and improving the data of everybody.
Thank you, Dr. Bourgeault. Kirsten, we'll go to you next.
Well, I agree with both of the previous speakers. I do, you know, quantitative data is extremely important. We can't move forward without the quantitative data. And we need to identify where everybody is currently working. We also, in my opinion, need to look at what are the actual needs of our various communities. Here in Edmonton, we have a massive inner city problem. And we need to look at who wants to work in that environment and how do we get them in that environment. We have rural family doctor crises across this country, and we need to look at how do we get people to go into those. And if we don't look at what are the needs of our various communities in conjunction with the numbers, in conjunction with and everything going parallel to each other, but talking to each other, we're not going to solve any of these problems.
Thanks very much. Dr. Ross.
Yeah, I really want to pick up on that topic. Thank you, Kirsten. The need to overlay population health alongside our demographic data would really be powerful to allow provinces to adapt and better deploy our health workforce to meet the unique needs of the population in various areas. But to do that, we actually need to have more of a shared labor market, understanding across those jurisdictions. Is there attrition? Who's retiring? And then tailor our education and enrollment levels and training mixes to really meet those needs. But key to that is population health. And who's been left out of their discussion to date on how we improve our healthcare system really is the patient, and looking at ramping up, empowering patients and giving them the tools that they need to be healthier from the outset. And that's education that can be provided right at the basis from a school level, part of our communities, part of our municipal leads. These are potential leverage points that we haven't really fully explored to ensure that our population is healthy moving forward and avoid the need for more complicated healthcare downstream.
Thanks, Dr. Ross. Dr. Brousseau.
Yes, I just want to say that I echo my colleagues about data, and just an example, when we went through the crisis during the pandemic, if we had the right data and robust data, as France has, we would know where were our healthcare professionals. And I'm just giving France as an example. And when they were able to ask nurses to go from Paris and go to Guadeloupe or Martinique to support nurses down there, they were, running difficulties with the pandemic, and they were able to see where nurses were working in different areas, and that's what we need as well in Canada, and that will prevent us, as we are the crisis where we are right now. If we had in the past, we do have data, and as Dr. Bourgeault says, it's one thing to have data, but it's another thing to interpret them and to understand how we can use it to improve our healthcare system and all the access of care in different area of our healthcare system across the country. Thanks.
Thank you very much. We do have one last question before we move into next steps. And I've adapted this question a little bit based on what I've seen in the Q&A. These conversations about the need for change in our health workforce have existed for years. In particular, one of our Q&A questions indicated a 1944 Saskatchewan Health Services Planning Commission that had some recommendations, some of which we've been talking about today. So I would ask panelists, what's different this time? What will it take for us to collectively move towards action? Dr. Brousseau.
I'm just going to put that down my. But first of all, CNA is pleased with the content of the Health Minister's Charlottetown communique recently, and support each goal set on the health workforce retention, education and training, international credential recognition, labor mobility, and data. As per the division of power in our federation, provinces and territories have the lead on health services delivery, and they are accountable to make sure that each population receives the care that they need. Major health reforms will be led by professional and territorial government for sure, and yet all level of government and every health partners have a role to play to improve the healthcare system and get, and reverse the situation. And it's important to point it out that retention is the most urgent priority, because if you don't focus on retention, how can you resolve the healthcare crisis that we are going through right now? That's going to be a huge issue, and which will increase if we improve workplace wellness. Want to make sure that each professional are happy to work where they are working. And this is the responsibility of all healthcare organizations. And that's where the needs need to change. It's inside the healthcare organization. And we are thankful for the federal government's work on the availability, sharing, standardization of health workforce data to improve planning, as well as supporting the establishment of the Center of Excellence for the future of the health workforce. And we will support this project and bring a nursing perspective to the table. On one of our pre-budget recommendations focuses on encouraging nursing education and training with specific funding for underrepresented group that we always forgot. It's all about including Indigenous nurses. And we must train more Indigenous nurses, even up north as well, to make sure that all Indigenous population receive the care that they are allowed to receive. In rural and remote as well. We are closely following the development of bilateral agreement between provinces and territories with the federal government, as well as the accountability of process. We were quite happy recently to see that the goal set by BC Action Plan, which recognizes our health human resources challenges and focuses on retention and mental health among health professionals. And to end, we believe it is now time for the federal government to create a pan-Canadian health human resources strategy. Then we are hopeful that data collection mechanism in bilateral agreement set the groundwork to make this a reality for the future of the healthcare system. Merci.
Thank you very much. Dr. Ross.
Thank you, Victoria. So I want to touch on what's different this time. I've been a family practice physician for 30 years, working in Canada, going from a place where I was everything to everybody in my practice panel, and was able to manage with the balance of a few really complex patients and a largely healthy population underneath that was younger. What's different this time is the increased complexity of our aging population and increased complexity of chronic diseases, the rise in mental health and addiction challenges that overlay at least half of what comes through a family physician office. All of these things are time consuming and involve multiple coordination points to such a state that we can no longer be everything to everybody and meet the needs of our population. So what is different is that we're aging as a population, our workforce is aging as a population. The challenges in meeting the needs of patients inside the system has become untenable in many circumstances. And what we offer patients and what we are able to offer patients is becoming increasingly limited. And healthcare workforce is burned out in droves in direct response to that. That's why this is different. It's why parties are willing to break down their silos, or as I affectionately call them, cylinders of excellence, and work across those cylinders of excellence to really truly deliver on what the patients need as our primary goal. And we're going to do that collaboratively. And I echo Sylvain's comments on the Center of Excellence. Absolutely, it's critical for us to come together with that framework, but I don't want that framework to take 10 years. We need to get that minimal viable product off the shelf and start iteratively building towards that to address the crisis that we're facing.
Yeah, I would echo, we need to move, and we need to move now. I think the context is very different, although as we mentioned at the outset, these challenges have been with us for a long time. What is different now is that we are in a context where every single health system globally has been affected by the pandemic. And it speaks to the point from one of the questions in the chat about, we typically, because we are a high-income country, solved our mismanagement of the health workforce system by increasing the levers for international recruitment, or when we had too many, we decreased the levers for international recruitment. We have basically, over my last, examination of this over 35 years, we used two levers: increase enrollment, decrease enrollment, increase international recruitment, decrease international recruitment. And we have not fundamentally changed the system. We cannot do that. We cannot do that by being good global citizens, relying on the input into training health workers and then recruiting them here. That's different than integrating the internationally educated health workers who are here. So I just want to be very, very clear on that process. So the other thing, and I think that we have some opportunities for quick wins. We absolutely do. There are pockets of innovation in Canada. We saw that when we did a 2014 review of scopes of practice, like really innovative models, and there were just challenges to spread and scale these initiatives. Let's take those pockets of innovation. Let's shine the light on them and figure out, how do we spread and scale? It doesn't have to always be made in Alberta or made in Quebec or made in Ontario, right? We can learn from each other and learn from other jurisdictions. Everything is about being flexible and adapting, not just adopting it, what works in our setting. So let's find what those innovative models are. Let's spread and scale them. Let's dedicate some resources to that. And that is what, again, my hope is for those quick wins for a Center of Excellence, while we put in that foundational data planning infrastructure, getting people started and improving it every year as we go along. That's an investment that I think is really important for us to really shine as leaders. And that's the aspiration of the Center of Excellence, is to be international leaders. Let's do that. Let's skate to where the puck is going to be, not skate to where the puck was or where it is. Skate to where it's going.
Thanks very much, Ivy. I think an important piece for us to take away, skate where the puck is going, and let's be practical in what we're building. Kirsten, would you like to add?
You know, I think COVID really did highlight the pandemic and the shortages that are happening. It was a massive wake-up call for all of us. And as many of us have been over the years very vocal about the changes, you know, one person had already mentioned way back in Saskatchewan back in the 40s, they had talked about this. We as the leaders of our various organizations are fighting hard to make these changes, but where we really need the people to listen is the government. And unfortunately, we're heading into another election cycle, and we need to keep this momentum going, because without the government working with us and pushing as hard as we are, I fear that we may not be able to bring in all of these changes. And that's going to be a really, really huge barrier to overcome, in my opinion.
Thanks very much. Well said. Somehow we have already exhausted our hour together, and we do have just a couple minutes to share some next steps. Just wanted to thank, firstly, all of our attendees for your participation today, as well as to our panelists, Kathleen, Sylvain, Ivy, Kirsten. Thank you very much for lending your expertise to today's panel. I feel like in today's discussion, we covered a lot of ground, from discussion about how we're approaching the problem of solving our health workforce challenge in Canada, as well as what it will take to move towards the change. So there's been a good balance of problems, problem identification, as well as some of the solutioning. And so as we wrap up, a couple just reminders, and thank you to Taryn for putting up the slides for us. Appreciate it. Just a reminder, first off, to please complete the survey that will be shared with you in a few moments' time, to just share any feedback that you had about today's discussion. We also wanted to share on this call, first, as this has not gone out to our marketing team or our marketing yet, that we will be hosting another webinar focused on health workforces challenges in the new year with folks from the federal and provincial governments to follow up on today's discussion. This webinar is being planned for Tuesday, January 23rd at noon EST. We hope you can join us. A link to register to this event will be sent after the meeting, as well as some other events that we thought may be of interest to folks who attended today's conversation. Again, a big thank you to everyone for your participation today. Have a great rest of your day.